Hello, my name is Antidiuretic. In this video, I'm going to take you through ADH, also called vasopressin, right? So ADH is called Antidiuretic Hormone. It is synthesized in the supraoptic nucleus and the paraglandicular nucleus. It's mostly synthesized in the supraoptic nucleus, right? So these nuclei, right, are a collection of cell bodies where exons which run into the posterior pituitary gland. So in the posterior pituitary gland, you see that it is packed in vesicles and secreted by the posterior pituitary gland, right? So this antidiuretic hormone, in its name, you see that it's antidiuresis, right? It prevents the loss of water in urine, right? Because diuresis is losing water, right? So that's one of the functions. Also in its name, you see that it's called vasopressin. It constricts blood vessels, right? It reduces their diameter, and in that it causes an increase in blood pressure, right? We also see that it works via certain pathways. The first pathway in which it works by is the cyclic AMP pathway, which is a G-stimulated pathway, right? So it works via this pathway in the kidneys, via the V2 receptor, right? So we see that in the collecting ducts of the kidneys, it causes the reabsorption of free water, right? That is water without, which is stimulated not because of ions, right, such as sodium. It's just free water. It itself causes the reabsorption of water, right? Now, then in the blood vessels, it's due to the first receptor, which is the V1 receptor, right? Then it also works in the liver, in which it causes glyconeogenesis and glycolysis. It's a stress hormone, right? It's diabetogenic. It increases the amount of glucose in blood. Since when you are in a stressful situation, you need energy, right? Now, we also see that there are factors which stimulate its secretion. So the factors which stimulate its secretion, as you can see in this diagram, I've written osmolarity, right? So we see that the normal osmolarity in blood is roughly between 280 to 300 osmoles per liter. So we see that whenever there is a decrease or an increase in this osmolarity, there's an effect on ADH secretion. So whenever the osmolarity is high, that is the amount of salt in blood and that is in plasma and in the extracellular fluid is high, you see that ADH secretion is increased. Also we see that when there is a decrease in whenever there is a dilute plasma or dilute extracellular fluid, we see that its secretion is depressed. Now, we also see that it's stimulated by blood volume. How? Whenever there is a decrease in the amount of blood going into the heart, that is its volume, you see that it is stimulated, right? And also, it is stimulated by angiotensin II, which was talked about in the previous video, and also blood pressure. So whenever there's a decrease in blood pressure, we see that vasopressin is stimulated, right? So as to increase the blood pressure, right? Now the factors which decrease its secretion, we see that alcohol it decreases the secretion of ADH. That's why you see most alcoholics, they usually urinate a lot. This is because of inhibition of ADH. Right? That's about it in a nutshell. Now, there are two clinicals which I'm going to talk about. Now, going towards the clinicals, we have what is called syndrome of inappropriate ADH secretion. So this is a condition where there is high secretion of ADH. It can either be primary, that is occurring in the hypothalamus, or secondary, occurring in the lungs. So anything that causes an increased secretion of ADH in the lungs or in the hypothalamus can lead to the system of inappropriate ADH secretion. For example, in the lungs, if there are small cell carcinomas, they can secrete ADH and lead to this syndrome. Or in the brain, if there is meningitis or some form of a cancer to the pituitary gland, the posterior pituitary gland, or the supraoptic nuclei, it can lead to this condition. This is a paradoxical effect in which the blood volume, right, is high, right? Yet we see that the amount of sodium which is collected in the collecting ducts will be high also. So this is that kind of paradox. We have a high blood volume, yet we also have a high sodium. There is not an increase in blood pressure. There's no edema, right? So how does this paradox? How is this paradox maintained? We see that in the heart there is secreted what are called nitric peptides. So these nitric peptides, they secrete sodium, and we know that where sodium goes, water follows. So this kind of gives a balance to the osmolarity, right? Now in diabetes insipidus, it's where we have low secretion of ADH, and it can be primary or secondary. Primary, that is also called neurogenic, occurring due to defects in the hypothalamus, or secondary, occurring due to defects in the kidneys, right? And you see that in primary or neurogenic diabetes insipidus, it can be treated using desmopressin, which is a synthetic form of vasopressin, right? And in nephrogenic diabetes insipidus, we do not treat it using desmopressin because it's a defect due to the V2 receptors in the kidneys. So we rather use what is called thiazide, right, which kind of stimulates these receptors and cause their expression in the collecting ducts, right? So just a quick summary. ADH, it's an antidiuretic hormone. It causes the reabsorption of water. It prevents diuresis, that is the loss of water, right? It's also called vasopressin because it constricts blood vessels, right? And it does this via the IP3 and DEG pathway, right, which was talked about in the previous videos. And also it causes glycogenolysis and gluconeogenesis in the liver. And also we see that the stimulants of vasopressin are usually the decrease in blood volume, the decrease in pressure, and the stimulation by angiotensin 2, right? And we also talked about the decreasing factors, which are alcohol, nicotine, dilute plasma volume, right? And a decrease in pressure. Then in system of inappropriate ADH secretion, there is high levels of ADH being secreted, and we see that there is kind of a paradox where there is high levels of ADH, yet we have high levels of sodium being accumulating in the kidneys, right? Then in diabetes insipidus, we talked about the fact that it's a condition where we have dilute urine, and people who suffer from it usually have low levels of ADH, and people who have a nephrogenic diabetes insipidus are treated with thiazines, and those who have a neurogenic diabetes insipidus are treated with desmopressin, which is a synthetic form of vasopressin. So that's ADH in a nutshell. So thank you for watching, and see you in the next video.